you. Our next speaker is Kelly Loggenberg. Kelly completed a BSc degree in human life sciences and honors in genetics at Stellenbosch. And she also did a master's degree in genetic counselling at the University of Cape Town. She feels strongly about taking a holistic view of patient care and believes there is significant value to a multidisciplinary approach which empowers patients to make decisions in keeping with their beliefs. Kelly is going to talk about pre-implantation genetic testing, the different options explained.
Right. Hi, everyone. My name is Kelly. I am the genetic counselor at Next Biosciences. So Next Bio is a genetic testing company, or a biotechnology company, and amongst other things, we offer many genetic tests as part of your reproductive journey. So what I'm going to be talking about today specifically is pre-implantation genetic testing, which has been mentioned by many of the speakers that have been up here so far this morning. So I'm going to try and give you a little more detail about the 3 different test options that are available. So before I talk about the test options specifically, I just wanted to give you an overview of where in the process this would fit in. So it is a test that's offered alongside your IVF treatment. Embryos created through IVF are allowed to develop until day 5 or day 6, at which point an embryologist removes a few cells or biopsy from each embryo, and those cells are then sent for genetic testing. So your embryo is frozen and remains safely at your fertility clinic. And then at the genetic testing laboratory, those few cells that were removed will be tested. And I'll talk you through the 3 different tests that can be done. Once those results are available, it will be sent back to your healthcare professional, who will then discuss with you and use that information to allow selective transfer of an embryo. Okay. Right, so there are 3 different options. The one that you've heard the most about this morning is pre-implantation genetic testing for aneuploidy. It's very often also called PGS, and this is where we screen chromosomes for problems, so extra or missing chromosomes. Pre-implantation genetic testing for structural rearrangements, or PGTSR. This is for a very select group of individuals who are known to carry translocations, and I'll talk through that in a little more detail. And then pre-implantation genetic testing for monogenic disorders, or PGT-M for short. This is very often referred to as PGD, and this is for couples where there is a known genetic condition in the family that there may be a risk of passing on to a future child. Right, so if we go into a little more detail for each of the tests, so PGT-A, that's the screening of chromosomes. So just to do a little bit of a recap, in most of the cells of our body, there should be 46 chromosomes in total. They come in pairs that are numbered from 1 through to 22, and then the last pair determine your genetic sex, with males having an X and a Y chromosome and females having 2 X chromosomes. If an embryo has extra or missing chromosomes, we know that that embryo is unlikely to be viable. It may not implant, it may lead to an early pregnancy loss, or in some cases, it may lead to the birth of a child with a chromosome condition. So the aim of PGT-A is to identify embryos that have the correct amount of chromosome material, because by doing this, we are improving the chances of a successful pregnancy. Who should consider PGT-A? So PGT-A can be offered to anybody who is doing IVF, but we know that there are certain groups where there may be more benefits. So chromosome abnormalities we know are linked to maternal age. So specifically from around the age of 35, we know that the risk of chromosome problems does start to increase. For couples where there's been recurrent implantation failure, there may be benefits. And then also where there are known sex-linked genetic conditions in the family. So PGT-A does look at the sex chromosomes. So if there is a condition that is inherited most often on the X chromosome, this can help us with the selection process there. Okay. So some of the benefits are listed here. And we know that the aim generally of PGT-A is that selective transfer of an embryo. And by doing that, we will be reducing the risk of a miscarriage going forward. It is important to also bear in mind the limitations of this test. So no test that we can do, genetic test, can guarantee a healthy pregnancy or child. And PGT-A cannot rule out single gene disorders. So remember, we're looking at the chromosomes here. We are not looking at specific genetic conditions like sickle cell disease or cystic fibrosis. That's a different test that I'll talk about in a second. And for couples that have had PGT-A alongside their IVF treatment, it's important to remember that all the routine pregnancy management should still be in place for them. Okay. Right, so this is a test that you probably haven't heard of before and hasn't, I don't think, been mentioned earlier. So this is a test, it's a bit of a mouthful, so Preimplantation Genetic Testing for structural rearrangements. And what that really means is that one of the partners in a couple is known to carry a chromosome rearrangement or translocation. So there are different translocations that can happen, and typically how you would know that this test is relevant to you is this is information that would be known to you in the family because of a history of rearrangements or translocations. It may have come up as part of genetic testing that's been done along your fertility journey. You may find out that you carry a translocation. So generally, in the case of a translocation, pieces of chromosomes have broken off and swapped places. So an individual who carries a translocation has no health concerns and may not know that they carry a translocation. But when they come to planning a family, they may experience pregnancy losses, recurrent pregnancy losses, because of passing on an unbalanced amount of genetic material. Okay. Right, so with PGTR, we know which chromosomes are involved, so we are looking for unbalanced amount of genetic material, so extra or missing pieces of chromosomes. It's important that if PGT-SR is something that you are considering, that the genetic testing lab is aware of the translocation so that they can check that the pieces of chromosomes that are involved can be detected by their technology. So have that discussion with your doctor. There will generally be a report available that can be sent to the lab to look into that in more detail. And then because PGT-SR is also looking at all the other chromosomes, not only those involved in the translocation, you will also find out about other sporadic chromosome problems that may have occurred. So again, here what we are trying to do is we're trying to detect embryos with the correct amount of genetic material, but the test cannot distinguish between embryos that carry a balanced translocation and those without. So only if the translocation or if the genetic material has been passed on in an unbalanced way will we be able to detect that. Right, so the third test that I'm going to mention is Preimplantation Genetic Testing for a monogenic disorder. So this is a test that is done where a couple know that either one of the partners is known to have a specific genetic condition, or they are each a carrier of the same recessive genetic condition. So in either case, there is a risk of passing on a genetic condition to their future children. And what they are trying to do is we are trying to reduce the risk of passing on this condition. So you will go through the IVF process. As with all the other tests, that biopsy sample is then sent for testing. It is a little more complex because before you even get to that point, there needs to be a workup where DNA samples are taken from different people in the family, typically the couple and then another relative who may have the same genetic condition, because each test that we do for PGT-M is unique to the specific mutation that is in that family and that couple may be at risk of passing on. So it is more complex than the other tests. It requires more of a workup, and it also takes longer because that workup takes some time. We need to review the reports, the mutation, and because it's a little more complex for these cases, there has to be a genetic counselling session before the time to explain the process in more detail going forward. Okay. So to take you just through the process, so the first thing is that you would discuss with your doctor that you're concerned about a specific genetic condition. That report will then be sent to the genetic testing lab. The genetic counselor will have a look at that, and we will discuss whether we need to do any further testing. We will then have a formal session where we talk through the process, what exactly needs to happen in that workup when the testing is done. And then the test is designed for each couple uniquely. That takes about 6 weeks to do. And then once that is approved, you would start once we know that the test design has been successful, you start your IVF process. The biopsy is taken at day 5. Those samples, that sample is sent to the lab for testing, and we then release the results, and your doctor uses that information to select an embryo that does not carry the known genetic condition that is in the family for transfer. Okay, so who should consider PGT-M? I've kind of mentioned that as we've been going along. So anybody that has a risk of passing on a single gene disorder. So for couples where both are carriers of cystic fibrosis, or if they have a child that is affected by a genetic condition, if we know what that condition is, we can screen for that going forward. The benefits are trying to detect those embryos that are unaffected by the condition. So we're reducing the risk of having a child affected by whatever condition may be in the family. Again, I've mentioned this with the other tests. The limitations, it is very important to remember that there is no test that can exclude anything 100%. All these tests that I've mentioned, so all 3, are tools to reduce risk, not to eliminate the risk. And we can never give you a guarantee of a healthy pregnancy or child, but we know that we are reducing the risk significantly. PGT-M, again, many people will ask, okay, so if we're doing PGT-M, are we testing for all genetic conditions? And we aren't. We are only looking for the specific condition that is known to be in the family. And that's why that workup is required, and we need to know exactly what mutations it is that we're trying to detect. So genetic counselling forms a very important part of the PGT process. So genetic counsellors, as you may have picked up from the introduction, so we are healthcare professionals that have training in genetics and also counselling. So we're there to assist you to make this process a little easier, to help you understand the information that the test can provide, how to incorporate that into your decision-making process. And your fertility doctor may refer you to a genetic counsellor at different points if any of these tests are being considered. Also, once results are available, you may be referred to a genetic counsellor to discuss results in more detail, to explain exactly what they may mean in your situation. So genetic counselling helps to ensure that individuals are making informed decisions and know exactly what information a test can provide, but also importantly what it can't tell us. It helps us to make sure that there are realistic expectations of what the outcome may be for these genetic tests. And then we also send you a summary of what we discuss, which is always really handy to refer back to. So you have that to look at and include in your notes going forward. Okay. So in conclusion, PGT is offered alongside IVF. Your fertility doctor will discuss these tests with you depending on your specific situation. PGT-A is available to anybody considering IVF, but will be discussed on a case-by-case basis because we know that there are certain scenarios where it may be more beneficial. PGT-SR is available if we know that one of the partners carries a balanced translocation, and this will have come up in your workup or in the family history previously. So typically this group of individuals will know about that translocation. And then PGT-M is available to those individuals where there is a known genetic condition in the family. And then just to end off by saying that genetic counsellors are available to discuss all of these tests, the benefits and limitations. So please do reach out to genetic counsellors, and your fertility doctor will have a network that they can put you in touch with also. Okay, and I'm going to end there. Thank you very much. Okay. Are there any questions? Okay, so yes, it can. We know that one of the causes for a miscarriage can be a chromosome abnormality. So in about 50% of cases of pregnancy losses, it can be as a result of a chromosome abnormality. So by screening embryos for these chromosome problems, we will be reducing the risk of a miscarriage. It doesn't eliminate the possibility because we know that there are many factors that play a role, but yes, it certainly can reduce that risk.
Out of the chaos and uncertainty of change, something extraordinary is happening. Evolving, becoming, birthing. A world where science fiction becomes science fact. Where we can reduce the risk of genetic disorders before birth and eliminate the inheritance of genetic conditions. Where we can collect stem cells and cryogenically store them for future potential therapies. And harness the healing power of the placenta to create regenerative biological products. Where we can create tests to detect viruses to make the world a safer place. A world where disease is no longer inevitable and the possibilities for restoring hope and health are limitless. Welcome to the world of Next Biosciences. Nothing is inevitable. Anything is possible.